In this video, I'm going to try my best to answer a huge question that comes up in patients who come to see me at my office. My name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida. And one procedure I do, which is not done in many places around the country, is a clitoris reduction. Not a labiaplasty or a clitoral hood reduction, but reducing the actual clitoris itself. Now, about half of patients who come to see me for this procedure notice that they had growth of the clitoris because they were on a specific type of medication. The two most common would be anabolic steroids, bodybuilders use, for example, which they usually have taken without a prescription, or what I'm seeing a lot more commonly now is testosterone replacement therapy, where for wellness reasons they are prescribed testosterone. It's usually in the form of a cream or a gel or pellets. What these patients typically complain of is that they notice the clitoris itself got a lot bigger, and this is especially more obvious when they are aroused. What many patients will describe is they look down and it looks to them like a penis, like it sticks out too much, and it can be really upsetting to a cisgender woman to have that issue. Some patients will describe irritation and discomfort, like that the area is too sensitive, that it's always on, they wear certain types of clothes and it's irritated. That can be a big problem as well. So the big question is, if you stop the testosterone or the medication that brought it on in the first place, is it going to go away? So my answer is always, let's wait and see. So I always encourage patients, if they're intending to stop the medication, to give it at least 6 months to see what happens. We do see sometimes an improvement in symptoms like irritation, that some of the puffiness and the hypersensitivity may get better, but as a general rule, patients tell me the size doesn't really change. This is especially true in patients who are young, who are using these medications. It's known to be more irreversible. There's not many studies on this. There's studies on mice, and it kind of backed up as well that this is considered pretty much a permanent change. I always say wait 6 months, see what improvement is there, but if it's still bothering you 6 months after being off the medication, it probably is pretty much going to be permanent. Thankfully, however, there is a procedure for this. It's a clitoral reduction where we preserve the nerves going to that clitoris. Super important. Usually we'll combine that in with a clitoral hood reduction, sometimes a labiaplasty, depending on the patient's preferences. And in this procedure, we get rid of the unnecessary erectile tissue, we reduce down the head of it, and usually lift and tuck things in. It's done under general anesthetic. It usually takes about 2 hours, 2 to 3 hours, depending on the patient's anatomy. We're accepting consultations for this procedure here in our Miami office. Just reach out to the link in the bio if you're interested. I hope this video was helpful.